Hello and welcome to the Cirque Lodge Behavioral Management Training video. In this training, we will discuss the treatment process that residents engage in while at Cirque Lodge, the importance of their behavior within the milieu, their rights, responsibilities, and consequences of misbehavior, and management and documentation of incidents. There will be a quiz that accompanies this training. You may take it as you listen to this video or take it at the end. It will not be a lengthy quiz, but it will go over the important and necessary parts of this training. Cirque Lodge provides intensive residential treatment for adults suffering from the disease of addiction to mind-altering chemicals. This philosophy adheres to a belief that alcoholism and drug abuse and/or drug dependence are complex problems and primary illnesses. As primary illnesses, the person afflicted suffers physically, psychologically, and socially throughout the disease progression. This progression is demonstrated in not only the compulsive use of mind-altering chemicals to the point of physical dependence, it is also demonstrated in the development of a set of beliefs, feelings, behaviors, and relationship dynamics that destroy trust and undermines a sense of safety and security in oneself and one's experiences in the world. Treatment, therefore, involves becoming abstinent from the physical influence of mind-altering chemicals, examining the physical, psychological, emotional, behavioral, and interpersonal consequences of the addictive process, and acquiring the recovery tools that support the remission process from the disease. Simply put, Cirque Lodge adheres to the disease concept model of substance use disorders, believing that those who seek treatment here suffer from a brain disease, a hedonic dysregulation within the brain. In other words, an inability to experience pleasure as others might typically experience it. And due to this dysregulation, substances, alcohol, drugs, behavioral addictions become associated with a survival process and become the #1 priority for these individuals. And so these folks seek out the substance before family, before work, before other pleasurable activities. The need and the drive to consume the substance is a necessary piece of their daily lives, and they don't process or recognize the switch being flipped between ordinary consumption of these substances and unhealthy and addictive patterns of use. Through the therapy process that they engage in here, we try to educate our clients to the disease concept process, helping them understand how addiction is playing out in their lives and why substance became their #1 priority, and try to identify core issues around what led to the reliance on these substances in the first place. Through identifying these core issues and engaging in the therapeutic clinical work, both in individual sessions and in process group, they can begin to develop other necessary coping skills and bring back on board life skills that may have gone by the wayside through their addiction. Residents here have individual therapy twice a week throughout their stay and engage in process group every day that they're here. In addition to this, they will participate in psychoeducational workshops facilitated by the counseling staff, frontline staff, or other trained professionals around important information, skills development, and 12-step program information. At the core of us is the 12-step program, and it's about engaging in the fellowship, whether it be Alcoholics Anonymous, Narcotics Anonymous, CA, HA, SA, whatever the fellowship may be, but engaging in it in order to get the support of another alcoholic or addict who has gone through the process themselves and entered into recovery, and be shown a way forward that may seem impossible. We engage them in 12-step meetings, in step work, in sponsorship, and do our best to connect them to a 12-step fellowship back home, wherever it is that they'll be transitioning to after treatment. Residents also engage in experiential while they're here, and have the opportunity to participate in our family program as well, which occurs every 3 weeks. The typical length of stay for a client is approximately 45 days, but our program is set up to be able to be completed within a 30-day window. Oftentimes clients will extend to 60 days or 90 days, and many may choose into an extended care program called Level 7 here, where they can stay for an additional 3, 6, or even 9 months, to the point where they achieve their first year sobriety date while in treatment with us. Regardless of when a client is discharging and going back to their home area or transitioning to a new area into sober living or other supportive treatment programs, we help them develop a continuing care plan that outlines what life will look like for them post-discharge. Oftentimes the clients who return to us who have relapsed will tell us that they did not follow their continuing care plan, and had they believe that they would have been more successful. And for those clients who do return to us for treatment after having relapsed, typically they enter into what is called the relapse track, which is a 2-week program with the option to extend beyond that if once here they realize that they would benefit from that. When discussing residents' behavior within the milieu, what we're primarily concerned about is the safety of the residents. And safety can be broken down into their physical safety as well as their emotional safety. With respect to physical safety, it's important that we always know where the residents are. We track all clients several times throughout every day to various programming events, but also being mindful of when they are or are not showing up to meals, coming down for medications, and also throughout the night. Graveyard shift includes a number of eyes on bed checks while the residents are sleeping to ensure that we always have everyone that we're supposed to have. And if ever somebody is unaccounted for, we begin a series of buildings and campus sweeps to make sure that we locate that individual. If you ever see a client going off-site and they do not have a pass or permission given to them to be able to leave off-site, it's important to notify the shift lead so that we can go and engage the client and let them know that they're not allowed to leave, and talk with them about what's going on if they're determined to leave anyways. It's important to note, as Gary often says, we're not going to chase a client down and tackle them in the parking lot. That's not what we do. They're always allowed and welcome to leave if and when they want to. But we do have a series of steps in place to be able to make sure that we're helping them to make the best choice for themselves as possible, and to try and mitigate whatever concerns they might have about remaining here if possible. And ultimately, if they decide that they would like to leave treatment before they were supposed to, we make sure that we notify the counselor on call, the administrator on call, and engage whatever resources we can to either change that if possible, or to make sure everyone is prepared for that client leaving against professional advice. With respect to violent behavior and a client's physical safety, Cirque Lodge does not tolerate any type of physical violence or threats of violence. We deal with these types of situations swiftly and severely, because it is important that this remain a safe place. Typically, we are able to de-escalate a situation involving a client and another client, or a client and staff, before it ever becomes physically violent in nature. We are a hands-off facility. It's important to note that. In other words, we do not intercede physically if things do become violent. We don't put hands on a client to disengage them from violently acting out. We notify the shift lead, and if necessary, call the appropriate authorities to come and intervene if the clients will not disengage on their own. Typically, the types of violent behavior that we will see here, if ever, would be an altercation between two residents. In the last probably 15 years, I can recollect maybe one or two instances wherein that has happened. Again, we do a really great job at interceding with verbal de-escalation techniques. Talking to a person, getting them outside, removing them from the situation that they're in that's causing the agitation in the first place. There are a lot of different intervention techniques that we can employ, and these are things that, depending on your position, you'll get trained on by your supervisor or by the other staff that you're shadowing. Self-harming behavior is another physical safety piece that we have to be aware of. We will sometimes have clients who engage in cutting or burning behaviors, and some clients who are suicidal. Being suicidal and feeling like you no longer want to live, and being suicidal and having an active plan in place to end your life are two different things. We manage as closely as possible and as effectively as possible clients who self-harm and clients who are suicidal within the facility, but we will not maintain a client in-house who actively has a plan and intent to hurt themselves. We will move to having that client transferred to a higher level of care to ensure their physical safety. And once it's been determined that they are no longer a threat to self, then we would look at a possible return to treatment here. For violent behavior or self-harming behaviors or suicidal overtures, what we will often initiate is what's called a one-on-one protocol, where we have one staff assigned to one resident to provide that close proximity, eyes on, immediate intervention ability, and so that staff and resident will basically be buddies until the staff is traded out by somebody else, or the resident is taken off of that safety protocol. Emotional safety. What we're talking about here is the ability to provide an environment for the clients wherein they can do the deep, vulnerable work that they're here to do. And if a client is not feeling emotionally safe enough to share and trust that they're not being judged or picked on or ostracized in any way, we do whatever we can to help them feel comfortable to do this work. We encourage them to express their feelings, whatever they may be, as they come up, and to learn how to talk intelligently about their feelings in a way that they perhaps have never learned how to do before. It's important that we intervene on inappropriate jokes or hazing behaviors. Jokes that are demeaning or put downs to a particular person or a particular group of people are things that the staff should be redirecting. Emotional volatility and outbursts on the part of a client can also affect the emotional safety. If we have somebody that's very angry and yelling, or somebody that is acting perhaps a bit bizarrely or engaging in active delusions or hallucinations, these things can be very upsetting and distressing for the rest of the population. And so clinically engaging and managing these behaviors as best we can and looking at when it's appropriate to transfer somebody to a higher level of care is also important. Lastly, fraternizing is a part of this section because of the disruption that it can cause within the milieu. Two residents spending too much time with one another, engaging one another in a way that excludes everyone else and can precipitate codependent behaviors or romantic behaviors, sexual behaviors. These are all a part of fraternization and can very much stand in the way of a person's engagement in their program. And so being mindful of residents who are pairing off, spending too much time with one another, or perhaps are even becoming flirtatious or sexually engaged with one another is important for us to track and to redirect and stop. The residents enjoy a number of rights while in treatment here at Cirque Lodge. These rights are listed out for them at the beginning of their resident handbooks, which are given to them during the orientation process when they first admit into treatment. These rights are also listed for you in your employee handbook for reference. We will not go over every point, but we will talk about a number of them on this slide and a couple to follow. The second point on this slide, impartial access to treatment regardless of race, religion, gender, sexual orientation, ethnicity, age, or handicap in accordance with Cirque Lodge admission criteria. In other words, we will treat every client the same. We will offer them the same access to caring and considerate treatment and offer everyone, despite our own personal opinions or difficulties, the same respectful opportunity to arrest the disease of addiction within their lives. The third point, considerate, humane, and respectful care regardless of sources of financial support. Regardless of where a client's financial resources are coming from, if they're here in treatment with us, we treat them as if we would anybody else. Someone who's paying more doesn't get any more care or attention than somebody who's here on scholarship. Oftentimes, more often than not, clinical staff and frontline staff are very unaware of the financial resources of a client. And it's because it's not important for us to be able to treat them in a considerate and humane way. On this slide, if you'll draw your attention to the last point, be informed of and actively participate in the formation of his or her own individualized treatment plan and have the plan reviewed periodically with the professional staff. What this point is really speaking about is that we include the resident in the development of their treatment plan here. We do a lot of great work about pulling together background clinical information, assessing the resident in a number of different ways, um, and, uh, and through interviewing them and family members, come up with important points that might be a benefit to focus on while the client is in treatment here. But one of the most important driving points behind what we ultimately focus on is what the client would like to. We of course have our standard programmatic pieces that we will um, work with every client on, the step work, the disease concept, things like that. But giving the client the ability to determine for themselves where and how far or how deep we go in their treatment is important. They have that right, and counselors work diligently week by week with their clients to make sure that we're encouraging them into work that we think would benefit them, but at the same time are hearing them and respecting their wishes around where we go and where we focus. On this slide, if you'll draw your attention to point 3, residents have the right to protection of their confidentiality, to be informed of and consent to in writing, except when required by law, the disclosure of any information pertaining to his or her records while a resident at Cirque Lodge in accordance with federal and state law. Confidentiality is protected for the clients while they're here in treatment with us. And we will not disseminate any of their information regarding their treatment, say, to outside entities, individuals, without the resident's consent in writing. We will not disclose the presence of an individual here in treatment with us to any outside individuals or entities, again, without written consent saying that we can do so. We will also speak about confidentiality with the clients here while in treatment, being mindful to not share what's occurring within one group to individuals who were not in that group, or carrying private, vulnerably shared information from person to person. Staff will not carry information from counseling sessions out to the other staff in an inappropriate way. Information that's shared in shift reports will be kept private as well. There are multiple levels of confidentiality that the clients get to enjoy while here, and that it's important for us to be mindful of and to make sure that we are adhering to. On this slide, if you'll draw your attention to the first point, residents have the right to be informed of his or her right to initiate a complaint or grievance procedure with the appropriate means of requesting a hearing or review. Primary counselors will refer residents to a resident advocate who will assist them with questions or complaints around the grievance procedure. In most situations, counselors serve as the primary advocate for a resident with respect to requests, issues, or concerns. If, however, a resident feels that that is insufficient, the counselor will refer them to their direct supervisor, who will serve as an impartial advocate on their behalf if residents don't feel like a counselor can serve in that capacity. With respect to a complaint or grievance procedure, we follow lines of authority within the facility. And so if a resident has an issue with their counselor, it goes to the counselor supervisor, to the clinical director, and from the clinical director to the executive director. If it's with a frontline staff, the grievance can be taken to a shift lead, from the shift lead to the coordinator, or to the program director. And again, from there up to the executive director. And so in general, it's just important to be mindful of who reports to whom. so that we can direct clients appropriately around what or who they need to talk to with complaints. If the grievance is with Cirque Lodge in general, the residents have the right to call our licensing agencies and report a complaint, and we will absolutely allow them to do that if they would like to. The information is on the very first page of their resident handbooks, and is provided to them for this purpose. So that they can report forward issues that they feel are present here, and we will work with our licensing agencies to respond to those grievances or those complaints. This slide outlines the responsibilities the residents have while in treatment here. First and foremost, we like the residents to know that they are responsible to themselves and the community for the following things. Being considerate of others that they meet here. Every person has a right to privacy, and they are responsible for not disclosing the names of information to anyone else. The common phrase that we have here is what you see here and what you hear here stays here. Residents are also responsible for being informed about their treatment plan in progress. If they're not understanding what's written or what a person is expressing, then it's important for them to ask so that we can appropriately explain it. They're responsible for attending and being punctual to all scheduled treatment activities and appointments, and for notifying staff if they're sick so that we can get them the help that they need. It's not okay for a resident to simply go to bed when they're not feeling well and miss programming and not come talk to us. They're also responsible for completing treatment assignments on time. They're responsible for participating in the design and implementation of their treatment plan, and for paying services that they receive here while in treatment. They're responsible for following community rules, for maintaining personal hygiene and grooming standards, and for expressing feelings as they occur. They're also responsible to explore options for continued recovery support, like the 12-step program, back home in their own area. For cooperating with clinical staff regarding drug screenings and searches, and for reporting to the community their own and others' enabling behaviors. There are any number of different consequences that a resident may experience while here in treatment, and ultimately consequences are meant to help mitigate unhealthy behaviors or to encourage a resident toward developing more appropriate or healthy skills. The items listed on this slide are ones that we talk about in particular because these are situations or behaviors that will ultimately result in a client being discharged from treatment administratively. And those include using or supplying mood-altering drugs or illegal substances or alcohol to other residents here. Non-compliance with medical care or treatment recommendations, or not meeting program expectations. Fraternizing, including sexual contact with another resident or with staff. Having people in their bedrooms that are not supposed to be in their rooms. Violently acting out toward others or property. Stealing, and leaving campus without staff knowledge or permission. Lastly, we're going to talk about incident management. Incidents are most easily defined as any event that's out of the ordinary. In other words, we consider anything that's outside of the standard and expected treatment day to be an incident. And typically these events involve some type of incident management or crisis management on the part of staff. Clinical staff and senior frontline staff have had ongoing training regarding crisis intervention, and with time, each of you will have the opportunity to observe and engage in crisis management as well. Ensuring the safety of the residents is always first and foremost our utmost concern, and helping them to learn about and shift unhealthy behaviors follows that. Documentation of all incidents is mandatory, and you will be shown how to do this when necessary and as a regular course of your training on the job in the charting system. Thank you.